We know that people with diabetes unfortunately have an increased risk of vascular disease, and so in Ascend we aimed to find out whether omega-3 fatty acids or fish oils might have health benefits for this higher risk group. For several decades, doctors have been interested in whether fish oils may well help to protect against heart disease. And this comes from a finding that when you look at different populations with different levels of fish intake in the diet, it seems that those with higher fish intake perhaps have a lower chance of heart disease. And in earlier studies before Ascend started, there did seem to be a suggestion that taking fish oil supplements might help to reduce the chance of heart attacks, although that's less clear from more recent studies. So 15,500 people in the UK with diabetes but without circulatory problems helped us with Ascend. These volunteers were randomly allocated to receive either the fish oil supplement, which was 1 capsule taken every day, or a placebo, a dummy version, which contained just olive oil. We sent them questionnaires every 6 months and asked them to tell us about any important medical problems, in particular about heart attacks, strokes or mini-strokes. The study continued for 7.5 years, and on average about 3/4 of the participants continued to take their study treatment throughout. This really very impressive commitment, along with Ascend's large size and long duration and very complete follow-up, we had full information for over 99% of the study population, means Ascend is a particularly important study, helping us to get really reliable answers. So when we analysed the data, we found that actually very similar numbers of people in the two groups, those allocated the real active fish oil supplements and those allocated the placebo, had in fact experienced a serious vascular problem, so a heart attack or a stroke or mini-stroke, or died from vascular causes. That means that the fish oil supplements that we used in Ascend unfortunately didn't seem to prevent these vascular problems as we'd previously hoped. It's disappointing to find that the fish oil supplements didn't seem to prevent circulatory problems, but this is very much in line with the results of more recent studies. There was no suggestion of any side effects from the treatment or any problems caused by it. For some people with a diagnosis of particularly high levels of certain fats in the blood, then higher doses of fish oil supplements are used as a treatment for this condition, and that's still recommended. But based on the results from Ascend, I think there's no longer any justification to be routinely recommending lower dose fish oil supplements as we used in Ascend to prevent heart disease.